Well, not only is it less intelligent than the right hemisphere, but it's not reliable at all. It's not unemotional either. It's given to fits of anger, irritation, and when its narcissism is offended, it can never believe that anything that it has done or it is responsible for can be wrong. And this kind of thinking has gone into culture. And so people who have that kind of thinking rise to positions of influence in the culture, and so the thing gets perpetuated. And in universities and hospitals, which are the two areas I've known best in my life, where they used to function rather well with the professionals, the professors and the consultant doctors and so on, being in charge of the ethos of the place, now it is all ruled by managerial bureaucracies who have no understanding of what it is that they're dealing with, unlike the professionals, but wield power over the professionals, power which is, in my view, wholly negative and very expensive.
Welcome back to Psychobabble, where we expose bad therapy and the liberal narratives that contribute to our poor mental health. I'm Hannah Spear. I want to thank you all so much for your continued support. If you're listening on audio and you want to access the members exclusive segment, then go to hannahspear.substack.com and upgrade your subscription there. If you go to the desktop, not on the app, then you can find a members exclusive section, and there you can access all of the members exclusive content. And for this episode, we will at the end dive into narcissism. So don't miss out on that. And as usual, please like and subscribe. And then I can introduce my guest today. I'll be speaking to Dr. Iain McGilchrist. He's a renowned psychiatrist, famous for his book, The Master and His Emissary, from 2009. And here he explores the divided brain. And he argues that the two hemispheres of the brain see the world in fundamentally different ways. In his more recent 2-volume work, The Matter with Things, Dr. McGilchrist challenges the philosophical assumptions behind modern science, arguing that our understanding of truth, value, and consciousness needs to be radically reoriented. And what makes his work so compelling is that it's not just about brain science, it's a cultural diagnosis. And he is uniquely positioned to write about this because he, not only did he train in medicine at Oxford and spend years as a consultant psychiatrist at Bethlehem and Maudley Hospital in London, but his background was first in English literature. And before going into medicine, he spent 7 years as a fellow at All Souls College. So today we'll talk about what all this means for mental health, psychiatry, and our increasingly disembodied culture. And as I mentioned, for the members exclusive segment, we'll get into how this hemispheric model can be used to explain the rise in narcissism and what we might do about it. Dr. McGilchrist, thank you so much for joining me on Psychobabble.
It's a pleasure and a delight, Hannah. Thank you.
So I wanted to first start with the common misconceptions. You also cover that in the Master and His Emissary from 2009. So, I mean, I even learned this in medical school, where you have sort of this. You think of the brain as with in terms of fixed modules, and this is there, and this is the language is here, and the sight is here, and memory is here. And well, in movies, you'll still hear some people say, "Oh, don't be so right-brained," or "Don't be so left-brained." So can we start there and sort of detangle that a little bit? What's your view on these pop psych?
Well, I'm afraid they've got to be forgotten, buried. And anybody who's listening to this and you think you know about differences between the hemispheres, please forget all of that. Put it out of your mind. I was definitely advised not to go into this area because I would ruin my career. And it was very well-meaning advice because differences between the brain hemispheres had become a pop psychology topic, a favorite of management seminars and things like that. And so the whole thing had sort of deteriorated. And there was a problem, which was that when people first were able to um, talk to one hemisphere or interact with one hemisphere of the brain at a time, which was much made easier by the split brain operation that was pioneered in California in the 1960s for people with intractable epilepsy, so that at least one half of their brain would not get caught up in the storm, the electrical storm. And when people started doing that, they did find differences, but they misinterpreted them, and that's really the problem. They thought of the brain as a machine, and a machine is something that does certain things. You want to know what is it doing. And so they decided that the left hemisphere was rational and linguistic, and the right hemisphere was sort of a little bit airy-fairy, unreliable, but emotionally more savvy. And that has gone into the culture. But they got the wrong answers because they asked the wrong questions. They asked the question you would ask of a machine, what it does. But if you ask the question you'd ask of part of a person, so what is it like in the left hemisphere? What is the world of that left hemisphere like? Is it different from the world in the right hemisphere? If so, in what ways? You'd find fascinating differences. And so the differences are not in the what, they're in the how. So each hemisphere is involved in pretty much everything. That's perfectly true. So the differences aren't about what they do, but they're about the way in which they do it. And by the way in which, I don't mean the mechanism by which they do it. I mean the manner in which they approach it, with what aims, because I think one has to get over the idea that one can't talk about biology in terms of purposes and aims, and clearly can, and with what sort of values. And if you do, you find that they are quite different. And there's a lot of evidence that comes from brain injuries, from brain accidents like strokes and tumors, from individual cases where we've been able to suppress one hemisphere at a time or excite the other hemisphere through currently TMS, but in the past they used ECT sometimes. And from other sources in cleverly designed experiments in which information goes just to one part of the brain or another. So in that range of experimentation, what we've discovered is that each brain has a different take on the world. And this is because it pays attention in a different way. Why is that? It's because all creatures have to solve the problem of how to eat and stay alive. And that doesn't sound too difficult to us because the two seem to go together. But if you're a bird or an animal or any creature actually with a brain, you need to be able to do two things at the same time. To look for something that you need, usually to eat, but it might be a twig that a bird might need to build a nest or whatever it is, be able to manipulate it deftly, quickly, and precisely. So it's only interested in going for things that it already knows what they are and they're things it wants. So it's looking out for this and that and the other. So the world is made up of pieces, bits and pieces. And those bits and pieces are quite different from what they are when they're in the context of a whole. And it's the right hemisphere that has the job of looking out for the whole context. Because if you think about it, if you're only interested in getting stuff for yourself, food and so on, then you become vulnerable to a predator because you don't see it. And you don't see your mate, and you don't see your offspring, and you don't see all the other opportunities. So there's room for two kinds of attention. In fact, each is absolutely essential. You can't do without either of them if you're a creature that wants to survive. You need to be able to do simple manipulation quickly, and you need to be able to comprehend, understand the whole. And that is the difference between the two. So the left hemisphere gives us the idea of a world that's made up of bits and pieces that we can put together in various ways to give them meaning. They don't have any intrinsic meaning or identity. They are disembodied. They have no past or future. They're fixed. They don't flow or change. They are simply components. It sees a world, in fact, of parts. So, for example, in the left hemisphere, the body is seen as parts: an eye, a thumb, a nose, a foot. Whereas in the right hemisphere, it is seen as a single whole, the so-called body image, which, of course, is an image not just in visual terms, but in all modalities. And it sees a world which is abstract, categorizable, and effectively inanimate. Whereas the right hemisphere is seeing a world where everything is in the process of becoming something. It is a flowing, interconnected whole in which nothing is ever completely fixed and pinned down, in which a lot of the meaning is not explicit, but implicit. In other words, the stuff that actually gives most of the meaning to life. Love, for example, friendship, art, music, religion, myth, narrative, you name it, poetry. All these things are taken literally by the left hemisphere and analyzed into parts. And in the doing of that, the important thing about whatever it is lost. The whole is decomposed, the purpose of the thing is gone, and its implicit message has disappeared. I realized this when I was an academic teaching English literature at Oxford, because I noticed that what essentially you could reduce the academic process to was taking a completely unique work of art that somebody had left because they thought it would speak to somebody else. And that was implicit. Its meaning had to be implicit. Once you explained it, laid it out in cold prose, it didn't move you anymore. You can ask about, a phrase of Shakespeare's where he says, "There is no art to read the mind's construction in the face." And you say, what does it mean? Well, it means you can't tell what people are thinking when you look at it. But as soon as you've rephrased it, it's lost a great deal of its magic in that particular place. But effectively, you've made the explicit implicit, you've made the unique general and an example of something that is a general something, and you've taken it out of its context in which it had meaning. And the context in a poem is the very words that it is written in and not any other word. The context of any work of art is that which makes it what it is, and it can't be sort of paraphrased or represented without loss. So those are the two worlds. I'm sorry, it took a bit of time there to...
All right. So if you have a right hemisphere insult, they would read that what you just said and not understand it at all. They would just take it completely.
People with right hemisphere insults of whatever kind tend towards literal interpretation. And for example, you show them a cartoon and it shows an elephant in a tree. And this is an example actually from the neuropsychological literature. And the woman looks at it and says, well, the first thing I need to know is how did that elephant get into that tree? Which is a sort of very literalistic way of thinking about what's being represented. And, people with right hemisphere damage don't understand the things that are not said, which are often as important as the things that are said. By their omission, they stand out. And a very simple example, which I sometimes give when I'm lecturing, is if I say, it's a bit warm in here today, I'm not just offering you unnecessary confirmation of meteorological observations of mine. I'm saying, could you turn up the air conditioning, open a window, or whatever? So this is what people miss if they have a right hemisphere insult of some kind. And of course, that kind of meaning is what gives...
Right. So then we have to relate to autism.
It is very similar to...
we have to relate that to the fashionable...
It is a fashionable diagnosis. And I think autism is complicated. I sometimes say I think there are autisms rather than just autism. But classical autism is very much like a world in which the right hemisphere is not contributing properly and the left hemisphere is hyperactive as attempting to understand things. And therefore people have this air that people describe of approaching things from outside like a visitor from another planet, trying to work out the rules whereby people laugh or the rules whereby they they smile or appear friendly or whatever it is, so that they can follow the rules. They want a handbook. And that, of course, is exactly what all of that is not like. It has to be spontaneous.
Yes. Yes. Okay. So why do you think that it has become fashionable to have diagnoses that are, can we say, left hemisphere focused?
Well, that is an example of one that is fashionable. I wouldn't say that the main example, schizophrenia, is subject to fashion much. So there's no evidence that I know of that schizophrenia is more widely diagnosed now than it was 100 years ago. But we do know that it was not commonly described in other cultures prior to modern Western culture. We have descriptions from Babylon, from Egypt, from Greece of many of the conditions we know: anxiety, depression, epilepsy, Parkinson's disease, dementia, all sorts of things. Mm-hmm. But the one thing, and we even have bipolar disorder, but we don't see descriptions of schizophrenia. And in fact, probably
when I say fashionable, I mean that people will come in and ask for the diagnosis. So then I think I'm pointing to this wish to see the world through this left hemisphere lens, because I've often experienced people coming in and saying, I think I have autism, Asperger's, or something that is, you've seen it on television.
And another common one is
the prevalence actually being there.
And another common one is ADHD, which is another left hemisphere active disorder. People sometimes think that it's probably more right hemisphere dominant, but it isn't at all. The right hemisphere enables one to pay attention in an appropriate way, whereas the left hemisphere is constantly, its attention is grasped by something that is a stimulus that it thinks, oh, I'll look at that, I'll look at that. And it has no consistent view of the world over space or time, or indeed over an emotional sort of timbre. So it lacks depth, the left hemisphere, depth in emotion, depth in space, literally seeing the world more two-dimensionally, and depth in time, seeing the moment without its history and without the projected future that it's likely to give birth to. Yes, you're right. I was merely, I knew that's really where you were going, and I was rather just wanting to say it is fascinating, though, that schizophrenia is a left hemisphere dominant condition, no doubt about it. But people don't ask for that one. They ask for those. That's really the point I would make. And I think there are a number of reasons why. One of the most obvious is that people say we're more aware of these things now. We talk about them more. Certainly we talk about them in the public arena more. The internet has brought these diagnoses to the layperson much more than they would have been aware of them prior to the internet. I think that's true, but I think the evidence overall shows that there is an increase in autism and the autistic spectrum, which is not just accountable for by an increased awareness and overdiagnosis. I think the second thing is that parents are anxious to get this for their children because it brings with it all kinds of benefits. They get more time to do their exams, they get special allowances, they're allowed to have a computer in class or whatever it may be. So they get sometimes money, they get special attention. And so through our charitable appreciation of the problems caused by a mental illness, we are actually encouraging that mental illness to be diagnosed. But I think the third thing, and this I think is where probably your question was leading, is that I believe our culture brings to bear certain pressures on people. Let me put it that way. It gives people with a predisposition, perhaps, to become more autistic. It gives them triggers that will make them reinforce that autistic thinking. Now, in the past, in a different kind of society, people would have thought, well, he, and it usually would have been a he, is a bit eccentric, but he's a nice guy, and we can, and over time you could have there would have been very little reinforcement of an autistic position. the person would have been embedded in a culture where they were working often close to nature with their hands, with other people, with animals, and they would have been in a very embodied world which had values that could be little by little understood by a person who was born with an autistic tendency. But I think that now, if you are born with an autistic tendency, the internet offers you all sorts of places to go where it will be reinforced. And much of the things, quite aside from the internet, that we do now reinforce those tendencies. Above all, the rise of bureaucracy. And bureaucracy is a typical child of the left hemisphere. Its aim is control. It wants and likes uniformity. It likes everything to be explicit and clear, none of this implicit going on. It is completely lacking in any sense of humor, any appreciation of beauty. It doesn't even care about truth. It's only interested in people fitting into the box. It is, in fact, a thoroughly disgraceful, mechanistic force in society, which is reinforcing tendencies in individuals who already might have a tendency to think in a more mechanistic way.
Right, so there's no place for them. But you come also parents in defense of parents as well. I've talked to a lot of mothers who come to me and say, we've gotten this diagnosis now, and what do we do? And many of them go because it's the only way that their boys can fit into the school system. So it's also that people come and they want this diagnosis, but it's also that it's the only way to solve their problem, because, as you say, there is no space for people who don't fit this, what you just described.
Yeah. Well, I mean, that is worrying, because it's all positive feedback. It's all loops which reinforce tendencies that are already there. So in a society in which I believe, and that was the argument of my book, The Master and His Emissary, published in 2009, and taken further in my 2021 book, or thereabouts, The Matter with Things, that we live in a world in which we've forgotten how the right hemisphere can see things. It sees things in a far more sophisticated way. Interestingly, it is more intelligent than the left hemisphere. And when I say intelligent, I don't only mean emotionally and socially intelligent, which it very obviously is, but it is more cognitively intelligent. It is more responsible for high IQ than the left hemisphere is, which is interesting, because the myth was that the left hemisphere was sort of intelligent and a little bit dull, but at least reliable. Well, not only is it less intelligent than the right hemisphere, but it's not reliable at all. It's not unemotional either. It's given to fits of anger, irritation, when its narcissism is offended. It can never believe that anything that it has done or it is responsible for can be wrong. And this kind of thinking has gone broad into culture. And so people who have that kind of thinking rise to positions of influence in the culture, and so the thing gets perpetuated. And in universities and hospitals, which are the two areas I've known best in my life, where they used to function rather well with the professionals, the professors and the consultant doctors and so on, being in charge of the ethos of the place. Now it is all ruled by managerial bureaucracies who have no understanding of what it is that they're dealing with, unlike the professionals, but wield power over the professionals, power which is, in my view, wholly negative and very expensive, and frustrates creativity, causes people to lose self-respect and the feeling of self-efficacy in the job that they've been trained to do.
Right. So you argue that we have created the world through our through our left hemisphere focus. Have I understood that correctly? That this is our own doing, because we sort of govern with our left hemisphere.
Well, yes. I mean, it's not that, of course, anybody set out to do it, but despite ourselves, if you like, we have become much narrower in the way that we think. And I think that this started with the hubristic movement called the Enlightenment, which the physicist David Bohm used to call the Endarkenment. because it issued in a sort of imaginative nightfall. And I have to say right away that I have great respect for the luminaries of the Enlightenment. Voltaire would have no truck with the kind of people who are their successors in the modern world. And if I'd been alive at the time, I would have thought it was a wonderful movement. But the thing is that it was fine for a while, but it, like so many movements, it went far too far. It thought that it could answer all the problems. It knew what to do with everything. It could explain everything. And reason and science are wonderful things. And I find on the one hand, I have to defend them against their detractors, but I also have to really in their own interest point out to them that they shouldn't claim. And I think the best scientists and the best people at using their reason don't claim that either science or reason answers all our questions. That is a fairly basic mistake. Science, for example, starts out with some perfectly reasonable principles that it's not going to think of things in terms of purposes and values. That's fine, and it's been very helpful in a limited way. But what it's not entitled to do at the end of the day is say, well, we find there are no purposes and no values, because, of course, it ruled them out. So we need to respect reason and science. They are invaluable tools for understanding the world, but we shouldn't ask them to do what they can't do, which is answer questions about things that simply go beyond them. For example, I mean, take something as important as music. Certainly in my life, music is one of the most important things. And it can't be just rationally explained. It is not that it's irrational, it's that it's supra-rational. Now, I think what we've ended up with, the world in which we think, we have been very successful in making things and making tools, and as a result, we've dominated the world from the West. We've greatly enlarged our wealth, our power, our status. And so what's wrong with this? Well, the answer may come from the fact that we have abnormally high levels of unhappiness, mental illness. I mean, we have an epidemic of these things in the modern West, as you know. And they are the result of our failing to understand the world. See, I sometimes say the left hemisphere is good at apprehending the world, which is getting a hold on it, like a monkey grasping something so that it can have it, eat it, or use it. But the right hemisphere helps comprehend the world, which is to hold the whole thing together. And it's that we have lost the grasp of. We don't understand what it is that we are dealing with anymore. We misunderstand what a human is, what society is, what nature is, what the cosmos is.
So what is your view on this mental health crisis? Maybe we get into that a little bit. I wanted to sort of see how you see this loss playing out in the psychiatric field, how we conceptualize illness and how we diagnose it. Just quickly, I reacted to how we focus on checkboxes and acute symptoms and overlook things like character and personality disorders. I think the prevalence of personality disorders is much higher than we think. Than we think that it is, because of this too fragmented look, too detailed look. And so when I read your book, I thought, yeah, maybe this is it. What is your thoughts?
Well, I think we need, in medicine above all, but in life in general, to bring together the workings of the two hemispheres, because we need them, each of them. And so, for example, in medical training, there is a great deal of emphasis on the learning of information. And that information is essential. If you don't have it, you can't practice as a doctor. But as one gets more proficient, and as one observes those who are experienced practicing their art, one realizes that it is as much an art as a science. So I noticed, and not just by any means in psychiatry, but watching neurologists and watching endocrinologists and others, assessing patients and interacting with them, that they were capable of seeing things in a way that was not simply led by doing inventories and ticking boxes and so on, but they were able to grasp the gestalt, to see the whole form of what was in front of them. And I find this very interesting because it is that gives you the key to what it is you're looking at, the sense of the whole of it. And when you get, as I've done and imagine you will have done as well, you get asked to give evidence in court in a case where somebody is said to have a psychiatric disorder. It's hard for the lawyers, not the barristers and so forth in court, not to go to DSM-4 or DSM-5 or whatever it is now, DSM-6, I'm so out of date, and say, 18, or the current ICD classification. The DSM is American and the ICD is European. But to say, well, here it says you need 3 of these symptoms and 2 of those, but I think this person has 3 of these symptoms and 2 of those. And what one has to try and explain to them is, well, yes, but a lot of people have these symptoms, but it's seeing the constellation as a whole, not just taking in the parts. So I think we need, so to come back to your question, I value myself as a doctor, or valued myself when I was in practice, as somebody who could bring a lot of information to bear, but in a holistic way, in which I was engaged with the patient as a unique human being. And I wasn't simply approaching them as an example of whatever. And in fact, I often needed to take with a pinch of salt a diagnosis that had already been made, including diagnoses that of an organic kind that were not made. When I was a senior registrar, which is the next rung down from the consultant, who is the sort of top of the hierarchy in this country, in psychiatry, I noticed that somebody who had, in fact, drop attacks, which are due to a cardiac cause, had been diagnosed as having temporal lobe epilepsy, but didn't. And somebody else who had a pernicious anemia had been diagnosed as depressed. And so I think as a psychiatrist, you're often having to go back to look for organic causes as much as the psychiatric. So I like the fact that we live in this, or operate as psychiatrists in this world in which we bring these 2 things to bear, but they're always unified in a picture of the whole. Yes. And I don't know if you do this, but when I saw patients, I used to, often I had an enormous amount of information. I'd see them for an hour and a half. And at the end of it, they'd say, goodness, you know more about me than my wife, my husband, my children, my parents, whatever. Because it was the first time they'd talked about everything. Yes. And then I would send them a letter, which was a condensation of this. And it did 2 things, because it showed them the whole picture and why I came to the conclusions I came to and what I thought the options for treatment were. And it also showed them that I had really listened to them and taken in all these things that they told me and how they went together to make a picture. Now, the trouble with the way a lot of people are now supposed, if they're not to be negligent, to approach these things is to do systematic assessment tools, which are basically a barrage of questions. And I, for a long time, thought an important one for a psychiatrist is to know whether a person is actually likely to harm themselves or kill themselves. And there is, of course, an assessment that nurses are supposed to do and ask this question and this question. You score out of 10 and so on. And I always thought this was a completely batty way to approach this for 2 reasons. One was I thought that the answers were largely worthless. And the other was that it made the patient feel that they weren't really being attended to. They were being treated as an object that was being assessed and scored. And I was very pleased to see research which shows that they are no better than random at predicting. So they are a very bad idea. But There was, particularly in the last hospital where I worked, there was a nurse who had worked on the wards for 40 years. She was approaching retirement. And she was actually an unqualified nurse, so she had more time to spend with patients and talk to them about their family and their life and so on. And if she said, I don't like the look of Mr. So-and-so or other, I would take notice and make sure I assess Mr. So-and-so. And very often she was right. She felt that there was something that had changed. Yeah.
Yeah.
There we are.
Yeah, so the questionnaires, where I worked, they would get the patients would get the questionnaires in the waiting room, so they would already be pre-filled in as we sat down, and and so they would be like, oh, I have a moderate depression, don't I? And it would really affect the way I didn't use them, but I saw that they were. I think it also has to do with because you also have a lot of young nurses and social workers, because we have so many psychiatric patients, and they need to sort of be guided, and so it's made for them. I ended up never using them, as I'd worked for a couple of years. I saw that they were useless. But I thought, okay, I think it's because we have too many patients to get to, so they needed to be standardized.
I completely agree. And it leads to so many errors because, if you try to diagnose yourself on the internet, you'll come up with all kinds of things that no doctor who was really experienced would countenance as a diagnosis. And there's a huge epidemic of people diagnosing themselves as having bipolar disorder because it's kind of somehow glamorous. I might be sort of, exciting and elated, and I might be highly creative and so on. So they want to be bipolar. And very often they have an emotionally unstable personality type, or they have an anxiety disorder, or or they're on some drug that is causing these things. And so it's so. I sometimes think that actually making a genuine diagnosis of depression is one of the more difficult diagnoses in psychiatry, because there are so many other things that make people unhappy, disgruntled, and so on. And then they say, oh, I'm depressed. Or somebody says, oh, you've got depression. Take these pills. And I'm not against pills. I'm sure you're not either, in the right place. I used them, of course. But I also used various kinds of therapy. I worked with a range of exceptional therapists who used different approaches. And I thought part of my job was to see which therapy was going to be appropriate for this person. And not only that, but which therapist would be the best for this person, would be able to really understand them best.
Right. And I think we focus way too much on the methods themselves and the theories well, speaking of pills, to quickly get to that and back to the whole left right hemisphere, I was also thinking about that because when we prescribe these medications, for example, the most common one, the antidepressants, what we tend not to tell patients aren't really given informed consent when it comes to all the side effects. And the most common one that I think they're not told about is the sexual dysfunction, the libido problems, especially for men. And the holistic way of looking at it would be to say, yeah, this will add problems and perhaps counteract the slightly positive effects you would get from the drug. But because we're so narrow-minded and see only the small parts, it's so then frequently prescribe these medications without looking at the whole picture. What do you think about that?
I do think that's right, but I have a caveat, which is people are highly suggestible, and a lot of the side effects of drugs are things that are commonly experienced by people with no diagnosis and no contact with medical services in a 2-week period. Research has been done on this. So, for example, dizziness, forgetfulness, anxiety feelings, whatever they are. I mean, these are just run-of-the-mill for everybody in daily, or perhaps my bowel function has altered and so on. So I used to do two things. I used to think it very important to check for side effects, but I used to say, because in this country, and I imagine in Switzerland and in Norway, that where drugs are prescribed, they always come with a big leaflet with all kinds of side effects in them. And so sometimes if I thought a patient was particularly anxious and likely to get one of the side effects simply from reading it, I used to say, don't read the leaflet, but tell me if you get any side effects. And when you come next time, I'm going to ask you some questions. I'm going to ask you some questions to cover that. So what do you think about that?
Well, I think that's questionable in regards to informed consent.
You're right.
Because we have so many reports now where people are really have had their lives destroyed because of the sexual dysfunction, and that just doesn't go away, and withdrawal symptoms, withdrawal syndromes that we're not aware of, and there was just an article about this, that they have to do more research on this withdrawal syndrome of antidepressant, because it's so prevalent. And so, but I see what you're saying. Psychiatric patients are especially tricky like that, because they come in such an emotional state.
Yes, and I note that I didn't suggest that the topic of side effects was not talked about, but I asked them open-ended questions about, have you noticed any differences in this? Just a quite quick system review.
Yeah.
And no, oh, well, that's great. And we'll just carry on. I'm not saying you will, but you might. I just need to know. And then, of course, when I came to taking people off medication, I used to say this has to be done under supervision, and it has to be done in a steady way. Otherwise, you will get withdrawal symptoms. And I must say that they are much more talked about now than they were perhaps 20 years ago. And that can't be because people were sort of not able to talk about them, because I was always very, very careful with patients when I was taking them off a medication. And I have also experienced myself of stopping a medication and finding that it was very unpleasant. So I'm definitely not advising people, quite the opposite, to not think about these things. But what I was trying to get around to was that it's much better if this is done the other way around, not the patient reading an abstract list of all the things that have been reported. I mean, after all, if you see cytosis or agranulocytosis or something like this, then you're going to look this up on the internet, and then you're going to think, I'm not taking this drug, it's going to kill me. And I could say to people, look, I've been prescribing these to literally thousands of people, and nobody has ever got this thing. So you know what I mean?
Yeah, I see your point. I see your point. But speaking of medications, I wanted to quickly talk about psychedelic therapy, because that has gotten a lot of attention lately. The amazing results and across the diagnostic spectrum. And I was wondering if we could relate that to right left hemisphere, because what happens is that you tend to focus on narrative. You feel unity, you feel wholeness, and it's just amazing, just that effect of coming back and feeling that, oh, there's a meaning to all of this. And that because if I understand it correctly, the psychedelics, they do take the focus away from ego and control. So what do you think about that?
Well, I've gone on record as saying that I don't think that it is a matter of liberation of the right hemisphere from the control of the left. I'm, as in everything, I'm not dogmatic, and I may be proved to be wrong, but my view is that what these drugs do is, and I think there's quite a lot of evidence from scans that this is what they do, is to grossly minimize frontal control of both hemispheres. And I think what disappears are the things that are due largely to left frontal control, and some of what goes with right frontal control also disappears. So I don't know, but I'm also I'm also a little skeptical of the hoo-ha that's been made about these drugs, partly because the research does show that some people have wonderful experiences, but it equally shows that many people have terrifying experiences on these drugs, and we shouldn't forget that. They can also destabilize people over long periods. I have a peculiar brain, I guess. I don't understand it myself, but I've been offered mind-altering drugs. I didn't take them as a student. Really wasn't interested. But since I wrote The Matter with Things, a number of people have said, oh, you know, and to cut a long story short, they've tried giving me cannabis and it didn't work at all. They said, you're not inhaling it, either. So we sat together and I inhaled it and so on. And then they said, here are some cakes dripping in marijuana, and they would take them and they'd obviously be off somewhere else. And I'd be saying, look, I took these cakes like 45 minutes ago. Should I be experiencing something yet? And then, you know, other things have happened, like the one I really wanted to try was magic mushrooms. And so I went somewhere on Maui with a man who had magic mushrooms. And he had them in a bar of chocolate. He had them in a bar of chocolate, and he took a third and he gave me 2/3. And I ate it, and absolutely nothing happened. There were no wonderful colored birds or fabulous butterflies or anything. All that happened was that when I closed my eyes, very disappointing. When I closed my eyes, you know, normally there is a kind of feedback from the blood flow in your eyelids. I could see sort of things like snakes wriggling. But then when I opened my eyes, everything was completely normal again. And eventually, I knew a doctor friend who believed in ketamine as a treatment for depression, which it is definitely shown to be for some people. And as my only diagnosed psychopathology anyway is that earlier in my life I had recurrent episodes of depression, usually about 10 years apart. And they're very well treated by medication. So I'm loath to join the bandwagon of people who think you shouldn't take antidepressants. I know my life would be impossible without them. But I took the ketamine anyway, because I thought I'm never going to have a chance to have pure ketamine medically prescribed and supervised by someone who's injecting it and sitting with me. And I have to report incredible disappointment. I felt slightly kind of woozy or slightly sort of giddy. I remember as a child being given something before an operation just to sort of calm me down. It was probably a benzo or something. And I felt a little bit like that. But nothing interesting at all. No angels, no voices. I was just a tranquilized horse. And so
very disappointing. I have the experience.
I know. Well, I feel very deprived. You know, why have I been singled out for this deprivation? But then I discovered that a lot of other people have the same experience, either nothing or something very unpleasant. And when I was on Maui, taking medically produced psilocybin, not just mushrooms, because the mushrooms had failed on both of us. She took this, and fortunately it had no effect on me, because I was able to sort of reassure her. But she had the most horrible experience on psilocybin, in which she said there were lurid colors, which were very disturbing and made her feel sick. And there were hands grasping at her, like demonic hands trying to pull her. And I kept saying, look, open your eyes. It's all right. I'm here. The world's here. I think what I'm saying is on an N of very little, but on research into much bigger populations, it's certainly not clear that everybody has a benefit from this at all. And there are unfaced problems here that I believe this is all being rushed because it sounds rather marvelous. And I think that, if it becomes legal to do this, then pharmaceutical companies have been given something for nothing. I mean, they can provide these things for next to nothing. They don't have to do all the research that they have to do to produce their other medications. So, There we are.
Yeah, and just, I mean, but we even though people report negative experiences, they also report coming away, having also this feeling of unity, although they had a negative experience. I mean, perhaps you did have an effect because you're also talking about how we need to look at things as a whole and trying to sort of champion for the right brain.
Yes, all of
No?
these things I agree, but I came to those conclusions long before I'd taken any mind-altering drugs. Long before, decades before. And they're consistent with my philosophical view of the world since I was a teenager. I've always believed this. I've always believed the things that are there in those books, and I didn't know how to justify them when I was...
Okay, how disappointing.
and I mean, some people have said, well, maybe it is that you don't need these drugs to see these things. I don't know. Or, I mean, it could well be that maybe, I mean, this is a more mechanistic thing, but maybe the receptors in the brain that these drugs latch onto are already occupied by a neurotransmitter that is the effect of taking medication. I don't know.
That could be okay. Very, very interesting. Okay, on that note, that concludes the free episode of Psychobabble, and we are going to go over to the members exclusive section and talk about narcissism. And here's a preview of that.
I mean, what you draw attention to is this extraordinary thing in our culture where those who identify with people who need protection and therefore sort of abase themselves are actually self-aggrandizing. They're saying, I'm superior to all you people who use your ordinary way of looking at the world. I have learned special skills to be this person.
If you're not joining us there, then enjoy the rest of your Wednesday, and I'll see you again Wednesday in 2 weeks. Thank you so much for listening to Psychobabble, and if you're listening on audio, please consider leaving